Well, I saw one, by the way, many years ago in the emergency room when I was acting as an emergency room doctor. This poor woman came in and her face was literally obliterated. In fact, she had a straw, and that was the only way to give her nutrition at the time. So it is a severe thing if it's neglected.
Right, but that's fairly uncommon, and they grow fairly slowly. So it takes a lot of neglect. And usually, even if you detect one, you don't have to rush to take it out the next day or something. It's a leisurely affair.
Mm-hmm.
Squamous cell carcinoma is a little bit more serious. So again, most of them, the vast majority, we'll just say 95%, don't metastasize, they don't spread, but they can spread. Again, usually if they're neglected for some time, but also some locations are just much more prone to spreading, for example, the lip. So certain areas have a higher risk of spreading. So a squamous cell carcinoma, you have to take a little bit more seriously. You got to take them all seriously. But now we're talking about something that's a cancer that could spread, that could kill someone eventually. Now, melanoma, everybody's heard about that, and that could be a very deadly disease. Fortunately, most melanomas, it's got a bunch of subtypes, which is beyond, I think, the scope of what we need to get into here. But most melanomas have a kind of a lazy phase where they grow, we'll say, parallel to the surface of the skin, meaning it's not diving down, it's not going deep.
Right.
So during this phase, it's not really invading. And if you catch it at this early stage and you cut it out, that's the end of it. There was an expression that I was taught, out is out. So you had cancer, you cut it out, it's gone, that's the end of it. So if you catch a melanoma early, it's a very treatable situation. If you catch a melanoma late, it's a very difficult situation, and the mortality goes up tremendously.
Right.
And fortunately today, there's better and better medications to treat that as well.